So, all right, and I don't see Tanya. Grant, have you seen or talked to Tanya or anybody? No, me neither. So, all right. So I think everybody knows who I am. I don't know who the VHA is, but we'll go through and we'll do introductions here in a minute. But I'm Chris Spears with the Reach Initiative. I do all the reentry councils, all the grants, all the behind the scenes stuff, event planning, all that stuff. So if I don't do direct service with clients, and I miss that, but that's all right. Somebody's got to keep everybody on track, I guess, and that's for some reason that's me. Oh. I will drop two things in the chat that are coming up. In Wheeling, there will be a viewing of Sing Sing, a movie. So I sent that out this morning, but I'll drop the flyer in the chat too. So if anybody wants to share that out, it's free, free movie there. So there's that. And then whatever week, the third week or so of November is Restorative Justice Week. So the West Virginia Restorative Justice Council is going to do a whole bunch of reentry not reentry circles, restorative justice circles. So there will be several held throughout the state. So they are looking for circle keepers and people to help coordinate the site and the location and all of that stuff. So I will drop both of those things in the chat. And then I will pass it over to Grant, and you can tell us what you got going on and then pass it off to somebody else.
Hey guys, my name is Grant Hoffman. I'm a parent resource navigator with the Monongalia County Public Defender's Office. So I do work directly with clients every day. I think we have like 30 some odd right now on my end. So I work specifically with abuse and neglect cases. So yeah, but I was on a meeting yesterday for the Community Education Group, CED. I don't know if anybody's familiar with them or what they do. But they were talking about 1115 waivers for Medicaid for incarcerated folks. Does anybody have any familiarity with that? Yeah, I just learned about all this stuff yesterday. So, but they were talking about trying to set up to where people, like as they're leaving incarceration, just to transition them to Medicaid and just like having health care and how that helps with recidivity rates and stuff like that. So I thought it'd be something worth mentioning here. And they had a few resources that they dropped in the chats during yesterday's meeting, which I'll now just drop the links to in this meeting so people can check it out. They're 1115 waivers, and they're specifically, I guess they're used.
It keeps going. Missing the first word. What did you say? Can you say it again?
1115 waivers. It's a number. So like 1115 waiver is what they kept calling it. But let me drop a few things in the chat that might help explain. Like I said, I just learned about these things yesterday, but I thought it would be worth mentioning in this because, you know, seems pretty important for people to have health care after leaving incarceration. Let's see.
If you have information, that would be amazing, because that's we keep hearing, and then we keep hearing that we don't know when the date is. We thought it would be June, and now we have heard October and November. So any information you have would be amazing, and I can share it out with the rest of my team. That you know,
I'll just drop in every link that other people dropped in there. So it may not even be stuff that pertains to it exactly, but it's still probably some good resources.
Okay, that's awesome. Yeah, and that's, you know, we've even talked about, you know, how they're assigned, because I guess they're assigned to be a pool, but then after 30 days they can switch the provider, and so we have lots of questions as well. So hopefully this can help us out.
And I thought we had a meeting recently with Sarah Whitaker from the Office of Budget and Policy. Do you know Sarah?
She's amazing.
Agreed. Really cool person. But I thought it might be worth reaching out to her to talk to her about these as well. It's something that I guess not every state has that. And then if you're incarcerated, you're also just getting like a limited Medicaid where you would just be like inpatient services and you wouldn't have like the full gambit of things available to you. So I think part of these like waivers that they were talking about is trying to like change that in some way. So I have that. And then the second thing I dropped in there was this like mapping thing, which if anyone wants to click on that link and check it out, I thought was kind of cool. And then this is a, I don't know if I'll be able to share that, but I'll try. No, that's not going to be able to work. So that first thing I dropped in there is talking about the section 1115 waivers. So yeah, Medicaid for pre-release services for people who are incarcerated. So I think it delves into that. And then I tried to drop in, someone put in a letter that was signed off by a bunch of different like medical associations, but pretty much just saying why they're in favor of those who are incarcerated, and then just like, immediately post-incarceration, why they're in favor of them getting medical services. And I think it cited particular data they had for why that improves outcomes, which I'm sure everyone on this call knows that clearly that would improve outcomes for people as far as recidivity and just, I don't know, making a better life for themselves. If I see anything else that comes up, I'll drop it in there as well. But yeah, thanks for letting me do a little spiel about what I just learned yesterday. Sorry, I don't know more. Just learned about this though.
That's amazing. That mapping tool, anybody that writes grants, save that, bookmark that. It's a huge help when you're compiling your data and things for grants, because I've used that definitely when I wrote the Appalachian Regional Commission Inspire grant, because that's their ecosystem. They want to know all of those things. So I encourage anybody to save that. And then, as you're talking about, minimal health care while they're incarcerated, when they come out, people don't know how to advocate for themselves and how to seek, additional, if they're not getting the treatment and whatever they think from their prescriber or their doctor or whatever, they're used to having limited options. They don't know that they can go find another provider, not to doctor shop, but to listen to them and say, these are the issues and this is what I'm feeling. So we find that a lot, that they just don't know that they have the ability to find another provider, that they're not stuck with who they're assigned with. So awesome. Thank you for sharing, Grant. Dr. Christy James, would you like to introduce yourself and what you've got going on? You gotta unmute though, girlfriend. You're still muted.
I was so charming and you missed it. So I was just saying that I'm actually just a community involved person. I am not representing a specific entity. I'm on some boards, but my goal is to be helpful and supportive in any way that I can, and to learn more, because if I know more, I can maybe share more in some of the places that I have a little bit of a voice. So and I live in the Clarksburg, Bridgeport area. I live in Bridgeport. I serve at First United Methodist Church during the sit needs, and have been participating in some of the in-person programs. That's who I am.
Thank you, ma'am. Aaliyah.
Hello, Aaliyah Tanner with Disability Rights of West Virginia. I am specifically what they call a CAP and PABS advocate for people with disabilities. CAP specifically looks at and works with Division of Rehab Services to help people that have disabilities overcome barriers of employment. And PABS is kind of sort of the same thing. It's for people who are beneficiaries of Social Security, any of the Social Securities except for retirement, overcome barriers of employment. They just don't have to be it doesn't have to be related to vocational rehab. It can be any barrier to employment. We have a lot of different programs that focus on different types of disabilities. I did put my contact information, our main number, and our website in the chat. I recommend anybody and everybody who is looking for resources to go on our website. We put so much on there, and we add stuff all the time. We even have template letters on there for people to use if they need to write strongly worded letters that they just not really sure how to do it. We have those. They can just plug in names and dates and addresses and use our letters. And then of course it has all of our programs and everything. Grant, while you were talking, I went to the West Virginia Department of Human Services website. Would you like the link for the 1115 that they have?
Sure. Yeah, man. Drop it in.
I'll put it in. I didn't know if you already had it. I didn't know if everybody had it.
I might have looked at it yesterday while they were talking about stuff, but yeah, I didn't have clarity as far as like where our state was with that. So please, yes, the more information, the better. Thank you.
Okay, I just didn't want to duplicate and cause confusion.
No, okay.
And since me and Rich have to work so close together and on a lot of different things because he is Division of Rehab Services, I'm going to pass it off to Rich.
Well, thank you, Aaliyah. I appreciate that. Good morning, everybody. I'm Rich Ward with the Division of Rehabilitation Services. Don't really have any updates for you or anything, but my email is in the chat, so please feel free to reach out if there's ever anything I can do for you. And it's good to see Miss Phillips on here. It's been a long time, so I'll pass it off to her.
Yeah, good morning. Sorry, I was trying to unmute. So I am Leila Phillips. I'm with the West Virginia Bureau of Juvenile Services. What it is I do is meet with juveniles while they're in detention facilities and then provide aftercare services when they are released. So I'm continually looking for resources that might benefit the juveniles that I do work with. So that's my role in this. I've been meaning to participate for some time, and usually I'm out of the office and on the road. But today was available for me, so here I am.
Thank you for joining us.
Thanks.
All right, Ms. Jen.
Sorry, I always have the hardest time unmuting. My name is Jen. I am the outreach coordinator for Northwood Health Systems Crisis Unit. We are located in the Northern Panhandle. We have 2 units. We have one in Wheeling and we have one in Weirton. And we can assist with mental health crises and also substance use disorder. So if you ever have anyone struggling mentally or they need to detox, we're about a 5 to 7 day stay. Our goal is to get them stabilized and then send them to a longer term rehab, outpatient services, whatever they need. But we will do all of that. Our case managers will work on that while they're here, get them placement. So if you have any questions or have a referral or anything, just let me know. Thank you. And I will pass it on to Seth.
Hey, good morning, everybody. I'm Seth Hansen. I'm the Partnership Development Manager with Groups Recover Together. We're an outpatient opioid use treatment program. We have 7 locations throughout the state, with the closest to you guys being in Clarksburg. We also offer a virtual hybrid option for treatment as well. And I did want to say that we have an open house coming up in September on the 18th. From 11 to 4. We're right off of Tolley Drive, off of Route 50 in Clarksburg. If anybody wants to get out of the office for a couple hours and hang out a little bit, and I'll get some more information out about that when we get a little bit closer. So, thank you so much. We'll pass it over to Taylor.
Good morning. I'm Taylor Darty with Aetna Better Health, and we are a Medicaid and CHIP option for the state of West Virginia. We are also the sole coverage for kids in foster kinship adoptive care and the CSID waiver now. That's children with serious emotional disorder. I do community development outreach. I live in Morgantown, but I serve 18 counties in West Virginia. So I don't get to be on here as much as I love to because I'm probably in another meeting or another event in a part of the state. But I serve the Northern Panhandle, North Central, and Mid-Ohio Valley region. And Grant, we have just got that information too, and we are still learning about the whole waiver too. So I appreciate you sharing that. That's why I like coming on these meetings, because you guys are educating us as well, which is really sad, but same truth. But anyway, so I just appreciate me sitting in and listening to what you guys are working on and how I can be of assistance. Thank you. Oh, and just a courtesy reminder, for any of your Medicaid clients that are over 21, as we all know, there's now 4 Medicaid options now: Highmark, Aetna, Unicare, and the health plan. If you have a client that's over 21 in West Virginia, there's now $2,000 to the dental Medicaid benefit. That started in July 1st, and it's going to be going on for 2 years. So it ends June 30th of 2026. Long story short, we're hoping, because of a lot of providers or dentists, I would just say it took a while for a lot of dentists to kind of get onto the board on this. And so if you meet a dentist that takes Medicaid, they'll say, well, I can't see you to January or February. So if you went to a dentist to get a cleaning and they find out you need, let's say, a surgery or you need something done, and the waiting list is even longer, we're hoping, one, this will be more suffice, help people get the care that they need, but also they can take advantage of the $2,000 to really cover their needs. So that, again, that's for any Medicaid dental member that's over 21, Aetna, Unicare, health plan, and now there's Highmark. And also, as we all know, DHR changed their names recently, and I'm guilty of still calling it DHR. It's now DOH for the Medicaid part. So clients, whatever their state services they're getting, like Medicaid, they're getting mail, and a lot of them are saying, oh, that's probably a scam. I never heard of that, and they'll throw it away. And so I've been over 100 events just this last month, and I can tell you a lot of our clients are not getting their paperwork because they're thinking it's a scam. So just kind of remind them just to check their mail before they toss it. I totally understand. It kind of looks, you see kind of a similar new name, you're just not familiar with this new name, and we're all struggling with it. It's going to take us all a while to get learning about it. But last thing we want is for folks to not get their proper paperwork in the mail or vice versa, quitting it because they didn't know they had it. And so that's really important to remind folks. So thank you.
Thank you. And Taylor, I'm sending you an email with a request. So we'll send that here in just a few minutes. And then
Sure thing.
And then let's see. Michelle, do you want to, I see you dropped information in chat. Do you want to introduce yourself too? Anything you've got going on?
It's been a really long time since I've been to one of these meetings. I'm Michelle Rivard. I'm with the VA in Clarksburg. I've actually been detailed as Compact Act coordinator for 8 months. So I had just come to a couple of your meetings and then disappeared off the face of the earth for 9 months. So I am back. I cover the 22 counties that the Clarksburg VA covers, which goes from Ohio to Pennsylvania to the Eastern Panhandle and then down to Webster and Braxton counties. So where you're located is part of the catchment that I cover. I'm part of the suicide prevention team as community engagement and partnership coordinator. So my goal is to reach the 11 of 17.5 veterans who die by suicide each day and are not engaged in VA care. And I do that by going out into the community, being a part of any group, any organization, either by joining or creating groups, just so that we can look at whatever it is that would help make veterans stable. And veteran justice stuff is actually one of our 5 priority areas for suicide prevention right now. So I wanted to be a part of this just to make sure that you know I'm here. I'm kind of like your resource person. If you don't know who to reach out to at the VA, let me know. We've got 2 VJOs. We've got Jason Bittenbender, who's been around for a long time, and we've got Daryl Bennett. So if you have anyone in any juvenile justice system who says that they're a veteran, if you reach out to one of them or reach out to me, they'll at least follow up and find out more about that veteran and see what services they qualify for at the VA. If they don't qualify for services at the VA, Daryl or Jason will make sure they get connected with services that they do qualify for. So I wanted to drop Daryl and Jason's contact information in the chat too. But I'm hoping to just be a part of these meetings whenever I can, just to kind of be the veteran voice to let you know that we're here. And, you know, I'm connected with resources inside and outside the VA. So if anything comes up where you need information, you have questions, please feel free to reach out to me. I think that's it.
Thank you. And, you know, please invite them if they want to join to any of the councils as well. You know, we have 21 councils across the state. I will drop that link here in just a second so that they can participate in any and all that they want to join. It's just, you know, just go to the link, fill out the form, and then you'll receive emails with the link to each of the meetings. So,
oh, that's good. Yeah, because that was what you cover, like kind of the north central, like Morgan, Marion. You're in that clump of counties, right? This group is.
This one does, yes, but there are 21 councils that cover the entire state. So I think, Grant, you're probably the only local one on here right now for this council. But the rest of us, we see each other, you know, sometimes several times a day, but that is exactly what we are here to do, is to share information. You know, Grant learned something yesterday, and every single one of us have learned and benefited from that. So, you know, and then, you know, Seth has his upcoming events there. So it's a learning experience for us. And so that's what we do, is we share events that are coming up. And yeah, I did drop another flyer. The Leading for Justice Summit will be in January, and it will be back in Charleston again this year. We're looking for proposals for anybody that wants to present and share information. I know Christy and I talked about it yesterday, and but check that out if anybody's interested in sharing information or proposals. So, what else? Anybody else have anything going on that I have texted and emailed our presenter and no response? But as we all know, in the areas that we work in, anything could happen at any time, and people take precedence over meetings. So something important has happened when they need to attend to that person. So he does have he's from Chest Health, and they have a new app that he wanted to discuss that is a companion app for caregivers and family members and things like that, because those people definitely need support as well. Compassion fatigue and exhaustion are real, and to have a support that, you know, you can just reach out and talk to somebody if you need to, that's amazing. I don't know. I don't have anything else. Michelle, I dropped the link over there in the chat so that the gentleman can join the reentry councils if they want to, if you want to share that with them. So.
Yeah, that's awesome. I just pulled it out, and I'll make sure that I have that, and I'm going to forward it to him.
All right.
Thanks.
You're welcome. Well,
Michelle, I got a question for you too. So say we have a client that is a veteran, how exactly, like, would we connect them to you guys? What service could you provide for someone that is a veteran that is incarcerated or involved in the justice system in some way?
What Jason and Daryl do is, if they're incarcerated somewhere, the minute they learn about a veteran, they go to wherever that facility is. And the first thing they do is talk with the veteran to find out if they truly are a veteran, because some people say they are and they aren't. And Jason and Daryl are both veterans themselves, and they don't care. They'll go see anybody who says they're a veteran. And then they kind of get a feel for whatever it is that they may need when they come out, what they may need while they're incarcerated. So they want connections as soon as they can get them, because what they found happens in the prison systems or jail systems is a lot of times they don't get any information that a veteran is even in the system until they're dumped out on the street, which doesn't really give them time. So the kind of services that they typically work with are, first of all, finding out if they qualify for the VA, which, depending on their service connection or what they qualify for, that can be seeing primary care docs, that can be dental care, that can be glasses, that can be hearing aids, that can be all kinds of mental health treatment, that can be RTP, substance use, or
mental health treatment. So anything within the VA system. Also helps with transportation. We have 2 different homeless programs, and we have other programs that help people get jobs. Even if, and again, Jason and Daryl have all the information on where they can get a job when they've been incarcerated, because that's not so easy. So anybody who says they might possibly be a veteran, if you just reach out to Jason or Daryl, they will definitely connect with that person and then kind of take it from there. And if they don't qualify for anything at the VA, they don't just dump them off. Then at least you have, the same thing with our homeless department, is anybody who says that they're homeless that might be a veteran, as long as we connect them with somebody in that department, they don't just dump them off. They make sure they're connected with what they need, even if they aren't veterans. So you don't have to worry about screening that out. All you have to do is connect them if they say they're a veteran. Because as we know, the VA, the qualifiers for different services they're not clear to me. 8 years later, I still can't figure out if somebody qualifies for services or not, or which it's case by case. But they'll connect them up with enrollment, help them get their DD 214, help them get IDs if they need them, whatever it is they need to succeed on the outside.
Okay. Well, good to know. I just took their information, their numbers down. I wrote it down. I'll probably save it here from this chat, but thank you. Yeah, good to know, man.
Yeah, and transportation is another big thing. At least we can help them with that piece. The VA, if they do qualify for services at the VA, they qualify for our transportation system, which helps out with some of the issues that we all have trying to get somebody somewhere in West Virginia.
Yeah, that's a common problem. When I talk to other public defender offices, other resource navigators, transportation is always huge, dude, especially in more rural areas. But yeah, I'm glad that if there's someone that could fill that role, that's really awesome. Yeah.
Yeah. We have with the homeless, I know that when people come out, a lot of times that deposit, first month's rent, last month's rent, finding stuff to put in that apartment, they can help with all that too through the VA. The VA's got, again, a little bit more time. Their caseloads are a little bit smaller and a little bit more, availability, resource availability, so that people aren't walking into an empty, if they can possibly come up with the money. First we help them get money so that they can get in, and then make sure they have more than just a floor to sit on. If we can,
And
but I think it's nice just if somebody says they're a veteran, you have another person to call to help out.
Yeah, for sure.
Start.
And to piggyback on that, Grant or Christy, if you know of any local foundations, I can, write grants for those foundations. Palatine of Huntington, that was one of the things that I wrote into the grant, was to be able to purchase cookware, dishes, cleaning supplies, towels, things like that, so that they have those things when they're able to come out of incarceration and get their first apartment or their first housing. So local foundations are a great place to be able to write small grants like that for a couple $1,000s. So if you ever see any, let me know, and I will be happy to work on that.
Okay. Yeah, I actually have some questions about grants in general. I was recently made aware too of these Title 4E grant. I don't know if you're familiar with that. It's stuff involving abuse and neglect cases specifically. But our office is kind of pigeonholed in that we're limited in how much direct service we can do because of like the whole attorney client relationship. But I was trying to partner with local organizations, including the United Way, to cover stuff like that, like first and last month's rent, those types of expenses when someone moves in. I have more than one client that's they're in this weird gap where they have a job, they're making money, but they're making just a little bit too much to get all the benefits and stuff they need. So they're in this little loop that just keeps these tires spinning. They can't seem to get out of it. But frankly, I mean, an injection of just $1,200 to $2,000 would get them over that hump, but you can't get that type of direct action from people. So yeah, that's kind of where I'm stuck right now, trying to figure out how to navigate people in that rut.
Yeah. If they are interested in education, Jobs and Hope is always a great place to help them, to get services and things like that. But people get stuck in that couple $100s, greatly reduces their SNAP benefits or eliminates them completely. And
yeah, Yep, exactly the same thing. And then I have a client who just got kicked off of Medicaid and like, yeah, just trying to navigate that system is difficult. And that's the argument that you often hear for these services is that, to give people the chance, like once they get on their feet or whatever, but then they get to a certain point and then it's just like you pull the rug out from under them. And this is not new. And it's, I don't know. I don't know how you convince higher ups or people that actually have power to care.
You go to the Capitol on those days of,
Right.
yeah, that's about it.
Yeah.
And go to local festivals because the politicians love those local festivals.
Yeah.
Yesterday.
I make sure to hit Roger Hanshaw every single time he's at the Apple Festival. I went to high school with him, so.
There you go.
But they do. They like those local festivals. They do a lot of politicking.
Mm-hmm. Yeah.
Speaking of going out in public and speaking out, I heard a lot of people talking about either they serve or live in the Clarksburg, Harrison County area. If you go on Facebook and check out the City of Clarksburg's Facebook page, they are actually having a public hearing on August 20th. It's going to be at the Robinson Theater. It's about, they're seeking comments, thoughts, ideas.
I was just going to say
To
that,
address. It's on, sorry, August 20th, Clarksburg. It's the City of Clarksburg Facebook page. They're doing a public hearing about addiction and homelessness. They're looking for ideas, suggestions, concerns. They're doing a public hearing. So I'm just sharing that. I just saw it on Facebook this morning. But it's on the City of Clarksburg's Facebook page. It's on August 20th at 6 o'clock. And it's seeking public comment. How can Clarksburg best address the effects of addiction and homelessness? Hopefully it all works out, but I just thought I hear a lot of Clarksburg, so I thought I'd just throw it out there. I also serve that area. So yeah, I think it's a good opportunity to, like you just said, just sharing your thoughts and concerns. So hopefully we can figure some solutions out. That would be great. Thank you.
I can share the email with you because there's an email that gives a very detailed, there's 6 questions that they're going to be asking.
Awesome.
So I can share that email, but I was going to say, I heard a plug for local festivals. We have the Black Heritage Festival the first week in September. It's the 7th is the Saturday. Youth Night is on the 6th, that Friday. And then of course there's like a family day on the 8th where it's like a churches and different auxiliary groups. But we're going to have some tables. And I thought I saw somebody on here. Oh yeah. From the VA. It's going to be there with us. So we're going to have some resource table, and we're going to talk a little bit more about what goes on that resource table. But if anybody's interested in just coming out and supporting that, I'd love to host you. I'm on the board. So, and I'm also, I think, the MC. So you'll see me a lot that day. But I really would love to get as much information as we can about support, because for a very long time, anything that had to do with homelessness, drug addiction, even any type of issue that had some stigma carried along with it, it wasn't talked about so much in the Black community. We kind of pushed it under the rug or only talked about it in secret. And so they've given me the opportunity to have resource table this year. And so I'm really excited about, moving forward with at least being supportive. I know Homes for Harrison will be represented. The VA will be represented. Summit Center has Healthy Minds. I think they're going to send some representatives from Healthy Minds. Celebrate Recovery will be there. I feel like I'm forgetting somebody. There's like 5 or 6 organizations that agreed to participate in that. So I can also share that information too.
Can you send that flyer my way? Because I plan to attend, but I never got the flyer. I've got
are you talking about the flyer for the resource table?
No, not for the resource tables, just for the event. Because I've got I got an email from Lou Hortenzio and
no, you got an email from me.
To be there.
You got it from me.
Oh, it did come from you?
Me. Okay. Yeah, I just copied Lou because he's my contact.
Okay, so that's what you have, because I've got that information.
Mm-hmm. But I can send you a flyer for the Black Heritage Festival. That's different. That's something separate. This is just a table that we are setting up, but I can definitely send you the marketing information.
Okay, thank you.
And I do want to, just as just as an aside, I see that, Krisha, you posted that, the information about the 20th. I don't know how to say this. I feel, this is a safe space, right? But Mark Jackson he is not a supporter of, programs like the Sit and Eat, anything that brings homelessness to the public eye. Or any substance abuse disorder. I invited him one day, not knowing that he was not a proponent, to the Sit and Eat, and I got like an hour and a half earful about how, the community does not want it, want to support those programs. And most of you know that the mission has changed. It's not the mission like it used to be because the community did not want it there. So if there's people that can come in support of, doing some of these things in Clarksburg, this community conversation, I have a feeling it could go left, but it might be nice to have some people that are in support of, with cool heads, that can talk without getting upset, because our city council is not proponents for, they seem to, they'll say nice things in public, but they don't want it.
Okay.
Just to be, so please don't repeat that, but just know, be aware. Be aware that it's not something that they're excited about.
And that happens everywhere. You want the best things for your city, but that doesn't always include everyone. But we here in this space always want to make a seat for everyone at our table.
We had heard recently that, and I didn't know this is true, because I heard it, that some Clarksburg police officers had like picked up at least one homeless person and just drove them to Morgantown, just dropped them off downtown, then drove back to Clarksburg. Kind of like a not my problem thing. But anyway.
Was it under the guise of taking them back to where they originally lived or something like that? Because we've had a couple of people that happen to, where they take them to Fairmont and drop them, or they take them to Morgantown and drop them.
This person is from out of state. They're from, I think, South Carolina. He was actually in our office for some time. We had interaction. I think he was, in the thralls of using while we were interacting with them. But we ended up getting like a mental hygiene for him the next day with the police department social worker. And he's since been committed and trying to get the help that he needs. But that's how we had heard about how he ended up here. So he was in Clarksburg somehow, and then they picked him up, didn't want to deal with him, the paperwork or whatever, just dropped him off here. Then we tried to do what we could to help. But he was really he was brought in, and then they released him for whatever reason. They wouldn't keep him at the hospital, and then he committed more crimes after that release. So then we went about doing a lot of the legwork ourselves just to assure, because it's not good for him. He's in the middle of a mental health crisis, and whatever victims of his crimes he's doing, like, you're hurting the community at large by not taking action for this. So I mean, I personally think they're partially responsible for whatever he did after they released him the first time. Like, that's on you guys too. But that's just one situation, I'm sure many.
I'm gonna piggyback off of what you said, Grant, and we see it with the mental health. We see it constantly. And one of the most common things, not most common, one of the common things we've seen was, bladder infections can cause especially elderly people to go, and have mental dementia pretty much, and then get more antibiotics and they're okay. I can't tell you how many times we see people in nursing homes or long-term care facilities get shipped to an emergency room for being combative dementia. The emergency room ships them to a mental health facility like Highland. Highland does a urinalysis, which should have been done in the long-term care facility, pumps them full of antibiotics, and they're perfectly fine. It's like, you guys are supposed to be taking care of them You know this can happen. Why are you shipping them to an emergency room? Okay, emergency rooms are full of doctors and nurses, and a urinalysis isn't that expensive. Why are you spending thousands of dollars to take them to Highland in an ambulance? And it's just, it's a ridiculous, ridiculous cycle that, as you can tell from my emotional outburst, really makes me mad.
Sure, rightfully so.
And I use that, but we see it with everybody. I mean, you might have somebody that's, you know, a homeless person or whatever. They just, oh, it's a mental health thing. Ship them off somewhere. Not my problem. And yeah. And when you've got the medical professionals, you got the law enforcement professionals, you got everybody doing it.
It really is. It's an out of sight, out of mind, not my problem. And it doesn't serve the person or anyone that they have been in contact with or wherever they're shipping them to. I've heard of, hey, let's give you an all expense paid trip to the beach, one-way ticket, send them to Myrtle Beach. That doesn't help them. It doesn't help Myrtle Beach. So yeah.
Well, you like in the scenario, they talk about wanting to save money. You know, they don't have money. They don't have money. So in this scenario, most of these people are on Medicaid. What costs more money? Doing your analysis and pumping them, giving them the antibiotics they need in the long-term care facility, or the 3 ambulance trips, all the diagnostics, everything else that went on, and it was all paid by Medicare or Medicaid or both. It makes no logical sense at all.
Yeah.
And think about the guy that they shipped up to Morgantown. They had to pay that cop hourly wage, wear and tear on the vehicle, gas, when there was probably something right there that could have helped him. The police officer could have taken him to and said, here you go. I'll get off my soapbox now. Sorry.
That's what we're here for, is just to share information and share stories and
Just like a widespread lack of empathy in general, I think we're just seeing like kind of the trickle down of the effects of an uncaring society. We're the ones that kind of left to pick up the pieces quite often. What do you do? How do you change the hearts and minds of the thousands and thousands of people it would take to have widespread systematic change? It's a big question. But as they always say, act locally. Do your small part. Act in a way that people will want to follow you. I don't know.
no, you figure that out and then I'll support, Grant Hoffman 2028. So
Sure. Big questions, man.
It is. Empathy is something we just can't teach people.
You guys ever heard of the psychologist Viktor Frankl? Viktor Frankl, yeah, I'm sure he has some of you have. I was kind of reading some stuff about him recently, and he was talking about like kind of the 2 pillars of a society. He talked about America specifically. He talked about freedom and then responsibility. He says we have the Statue of Liberty on the East Coast, and there ought to be like a Statue of Responsibility on the West Coast to bookend it. I think in today's world, you hear people go on and on about freedom. My freedoms are like, this and that. And maybe they've even lost sense of what that word really means, but they don't talk about responsibility. What's this responsibility that comes with being a citizen as well? They think freedom, there's a phrase, no man is an island. They think that just insulates them from being affected by other people, but you have a responsibility to your fellow man regardless. I don't know.
Well said, sir.
But Like I said, how do you instill that? How do you actually change the hearts and minds of people? That's the big question.
I think they have to experience it. Until they truly experience it on a gut-wrenching, heartbreaking level, they're never really going to understand it. One of the things we talked about yesterday in that PABS, they asked me to talk about the outreach that I'm doing and how I changed our outreach from going to like hospitals and schools into more of a grassroots thing. Where I'm going to health departments and, welfare offices and food banks and stuff like that. I've told my supervisor because she knows, and and I'll tell you guys because it's one of those things that I'm proud of something I've done is from 2011 to 2014, I was in abject poverty. I was working my hind end off, and and if it hadn't been for my family, I would have been stuck in that loop that you mentioned earlier, Grant. And my mom and dad own our family farm. So I was able to move in there, and it's a rundown old farmhouse, but you know what? It's warm in the winter and dry in the rain. I had a 3-year-old who's now 17, and I was getting out of a bad situation, and I'm a single mom. And I was trying so hard to go to school and to work. And I went and applied for all these the social benefits. I qualified for $12 a month in food stamps. What's that going to buy you? And the social worker from DHHR flat told me, quit work and I'll be able to get you some stuff. And she also told me flat out, lie. My mom and dad weren't charging me rent because I'm trying to get on my feet. So she said, have your parents write up a lease that says you pay rent. And we'll be able to get you some benefits, but you got to quit work and you got to do that. And I'm like, one, I'm not committing insurance, welfare fraud. That will put me in jail. And two, I don't want to quit work. So I could not be a good mom, a good student, and a good employee because I need sleep at some point. So I dropped out of school and started working full time, which I had full-time jobs. It wasn't, but it was like food was more important. And I was going to food banks, and my dad had goes to Sam's Club, so he would go to Sam's Club and buy cases of stuff. But if it hadn't been for my parents being there and being able and willing to help, I would have been living in some rundown, Lord knows what apartment. My daughter, not living in the best of circumstances. So that's why I tell people, I'm like, you have to experience it. You have to really and truly experience it. And these people aren't willing to do that. They're not willing to, they're not willing to go volunteer a Saturday at a food bank and see the moms coming in. They're not willing to go to Sharp Hospital and see how run down it is. And have you ever been inside Sharp Hospital? It's not good. It is not good. Our jail system buildings are in better shape than Sharp Hospital. They won't go inside those buildings. And that's what they need to do. They need to see it. They need to smell it. They need to touch it. They need to come out of that building stinking of the mildew and nastiness. And then they might get an idea of it. And I would love for one of them to walk into the hospital of Mount Olive and see the ceiling falling down on top of the inmates that have open wounds from surgeries. And yeah, that is exactly what I saw when I went in Mount Olive. They don't care. And you're not going to be able to get them in there. Good luck. Because I used to work for DNR. We may be able to get some bear tranquilizer. You know, just an idea. I have
Bit
connections.
much, but
I can just picture one of them waking up in the middle of Mount Olive's hospital and see that ceiling drooping down near, you know. And, and honestly, before I experienced that kind of poverty where I was literally wondering how I was going to put food on the table for my kid, and I was 30 years old and I had my life together. It fell apart through no actions of my own. It was actions of an ex-husband. I was kind and I was considerate and I was sympathetic, but I really didn't understand those struggles until I had to go through it myself. And I didn't really understand how bad things could be until I started going into these facilities and seeing them myself. Yeah, I've never been in jail. I've never been in one of those facilities as a patient or as an inmate, but after going in and just walking around, and it was when I got this job and I was doing I was going in with monitorings, because that's one of the things we do is we go in and monitor those sites. We're there to advocate for the people that have disabilities there, but we monitor them to make sure that they're taking care of them. That's why we're involved with the lawsuits with Sharp Hospital and the lawsuits with the foster care system and all that. And then I really started seeing how bad it was, and the news doesn't even begin to cover it. It's the tip of the iceberg.
and that's, stories like that, and, each of us experiencing what we have makes us better able to work with those that we do, because we have, firsthand experience.
Mhm.
And honestly, I mean, because I'm a little pushy, I have wrote to my own personal representatives and invited them, come with me. You want to talk about IDD waiver? You want to talk about how you're going to help things? Please contact Disability Rights. We'll let you go with us on a monitoring. We'll let you see what Mildred Bateman looks like,
Wow.
what Sharp looks like. I mean, of course, I get no responses, but you know what? They are my personal representatives, and and that's why I say I hit Roger Hanshaw up every single time I see him at that festival.
And
He is my representative, and I have every right to talk to him.
That's true.
that's what we need to do in our local communities, so.
Well, I commend you, Miss Tanner, for getting yourself out of that situation. I guess with the help of your parents too, but
Yes.
you've, since brokered that into giving back to people, and I think that's a pretty high calling. So good for you.
Oh, we have to do, I don't know. I mean, I feel like if I don't pay it back, then what good was it? Yeah, it helped me and it helps my daughter. And I'm trying to raise my daughter to be a good person, and she gets as fired up as I do. But we need people that have experienced it. I mean, we've talked in these councils about getting people who have experienced reentry and telling them, and having them, share their stories. And that's, I don't have a reentry story because I've never experienced that. But I do know that shame of sitting there in the line at that food bank, waiting for them to give you food.
And that's, the reach, that's what we do, is I am not justice impacted, but I am justice involved. I myself don't have my own reentry story. My parents do. My family does. So yeah.
Yep.
Well, this has been a good meeting. I appreciate we have learned a lot. We have shared a lot. We have supported one another. So I appreciate everyone. Thank you for all that you do and for all that you are. Some of you, I'll see you tomorrow for the Kanawha County meeting. And then others, I will see you next month. But if you have flyers, information, anything to share with me, Grant, if you come up with any grants, Christy.
Right, yeah.
Yep, you dropped over in the chat for me that you've got some ideas, and I think you texted me something, so. We'll do what I can to help everyone, so.
Thank you very much.
You're
Thank you,
welcome.
guys.
All right, thank you. Bye-bye.